fire roared through a section of downtown Hillsboro early on the morning of January 2nd, devastating several businesses. The Hillsboro Pharmacy and Fountain was mostly saved from the flames.
We got the building, so we're pretty lucky.
But there's extensive water damage.
We're not going to be to work on Monday in this location.
Kathy Smiddlecoffer is the manager at the business. She's worked here for 37 years. Right now, the focus is to get things cleaned up and the pharmacy open in a temporary location. They're getting the job done with the help of people in the Hillsboro community.
It's amazing what we've gotten done with just volunteers and people saying, what can I do to help? There's been a couple that have been like, 8-hour days in here, just, It's been awesome. So we're pretty blessed.
Jasmine Wynn is right in the middle of it all. She bought the Hillsboro Pharmacy and Fountain several months ago. To have this happen is devastating, but she says the response from the community is amazing.
I'm really surprised because I'm new here and everybody here support us. And I love the community. Because we've been serving vaccine and COVID-19 treatment and everything. And after we get back to our feet, we're going to try better to serve and pay back.
For the short term, they'll be a couple of blocks away on Southeast 2nd Avenue. There's a sign inside the building and buckets of paint and other supplies waiting for volunteers to get to work. This is just a temporary home.
We'll be back here. We'll be in here. It's going to be better. It's going to be new, but still have old employees like us, so can't get rid of us.
The goal is to have the pharmacy up and running at the temporary location by Monday. In the meantime, Wynn has 2 more other pharmacies, and they're filling prescriptions and dropping them off for the Hillsboro customers. Turning to our homeless crisis now, a new Oregon law requires death reports to note if people were homeless when they died. Multnomah County has been doing this for 10 years, and now other counties will do. Lincoln County on the coast will take note of the death of Walter Hergert. Walter died outside on January 5th in Lincoln City after leaving a warming shelter that closed once temperatures got above 40 degrees. Walter spent most of the time in Newport, where he was well known in the community. He was a fisherman, but had life struggles that led him to be homeless. That's according to nonprofit Grace Wins Haven. It's a homeless aid organization in Newport. Tracy Flowers is the executive director who says many people miss Walter.
I couldn't believe the response that we got. Hundreds of people between my personal page and my business page. Just talking about memories of Walter, being an artist, being a friend to everybody, sharing a meal with him, sharing a cup of coffee with him, hearing his jokes, and just the love and compassion that this man had.
Flowers says the homeless crisis is real on the coast, with dozens of people needing help to survive. Walter Hergert leaves behind a brother, other family members, and friends. Turning to the pandemic, doctors around the country are seeing a new trend with patients being admitted to hospitals. They're not sick, but they're testing positive for the Omicron variant. They're going to hospitals for other reasons, but simultaneously testing positive for COVID. In Texas, some hospitals are reporting 30 to 40% of patients admitted for other reasons are also COVID positive. The trend supports evidence that the Omicron variant is less likely to cause severe illness than the other variants. However, many patients don't have any symptoms. But it also presents a danger for, patients at risk and healthcare workers. With Omicron impacting all walks of life, we wanted to know, how are staffing levels looking for essential services like in healthcare? As Alma Mercati found out, it's a big concern across the industry.
At Brooklyn Pharmacy in Southeast Portland, signs on the door signal different COVID-related messages to customers, from vaccine availability to the lack of at-home tests.
So far, we've been really lucky, knock on wood, that we have not had any significant illness here, so we hope to continue that.
Owner Pat Hubble says his team is hard at work, filling orders, administering vaccines, and keeping up with safety measures as COVID cases begin to surge.
Protective plexiglass at the counter, spacing on the floor. My pharmacy, we have a small staff, and if we do have a small outbreak here, it can be a situation where we may have to close the doors for a day or two just to see if we can get everybody back on track before, we don't have any issues infecting anybody else.
On a larger scale,
really trying to protect against the tidal wave of community spread that ultimately will be here.
Virginia Garcia's Health and Safety Programs Manager Hazel Wheeler says they're also looking ahead while handling the current strains and shortages many systems are dealing with.
There will definitely be positives. There's just no way around that. And then the exclusions that will result from that and the contact tracing that we'll have to execute will definitely be something that we have to deal with. And I know that we're starting our planning on what that sort of constrained staffing looks like. But to this point, that's not really what the driver is of issues. It's just 2 years of pandemic.
Kevin Mealy, spokesperson for the Oregon Nurses Association, says staff shortages have been an issue for a long time. So it will be even more of a challenge in the weeks and months ahead with a highly transmissible variant.
So those gaps that were always there are now more apparent because nurses aren't able to be the Band-Aid that stretches over them and holds them together. And the fact that we've been reliant on solutions like traveling nurses and the National Guard speaks to the staffing crisis we're feeling right now. Our hospitals were only able to run at a very stretched emergency capacity with those supports in place. Without them and with more cases, we're looking at a very dire situation.
Clergy, teachers, healthcare workers, and protesters are raising their voices to support City of Portland workers as a potential trade strike looms. The District Council of Trade Unions has been working with the city on a new contract for its 1,200 city employees in 6 unions. Last month, it declared an impasse in the bargaining process. Now, workers could strike as early as this month and would threaten the city's ability to provide services to you.
We absolutely have provided critical services to the city. We've continued to keep the city working throughout, a worldwide pandemic. Whether that's clean water, sewer systems, transportation, all of the many things that we do, we've continued to do. And it's time for City Council to realize the value of their workforce.
The city is offering a 1.6% cost of living increase that would date back to the beginning of July of last year. It's offering a 5% cost of living raise that would begin July of this year. The union argues those offers are not in line with national inflation, which increased by more than 6% over the last year. Still to come, a Portland restaurant is changing the way you pay your bill. Why they say they're getting rid of tipping and what you'll have to pay instead.